Okay, I like to begin at the beginning and talk a little bit about what stress is, because this is a term that's used all over in the media and just in colloquial discussions, et cetera, et cetera. So we like to think of stress as something you experience when you perceive a threat or you have demands placed on you that are beyond your ability to cope, or you're exposed to something very distressing, right? So a stressor could be any event or situation or condition or demand that disrupts your balance in some way, or your equilibrium, right? We have, when we think about stress, we have biological systems that are set up for this, right? We have something called the sympathetic nervous system, where you have increases in heart rate, blood flow. You have the release of adrenaline and noradrenaline. All of these chemicals are released into your bloodstream to provide energy to muscles in your body, so you can, for example, flee or fight off some kind of threat, right? And we also have a neuroendocrine system. For example, there's certain hormones that get released, such as cortisol. These are hormones that are released from the adrenal glands, and again, help you cope with a kind of a long-term extended stressor, right? So all these things help you, for example, cope with a situation. Let's say if you're faced with a bear, right, or let's say in early humanity, you're being attacked by a competing tribe or something like that. So you have this biological system that's ready to help you cope with a dangerous environment, right? And this makes perfect sense. However, when you think about modern society, now our threats are quite different, right? We're not typically threatened by a bear in Montreal. I mean, maybe if you go backpacking in the woods, but certainly not in the streets of Montreal. We rarely have people, tribal people, trying to attack, our communities, right? The things we're worried about are things we conceive as threat in modern society. Is, for example, having someone give you a terrible evaluation at work, right? Or having people gossip around you, or talk behind your back, or having your partner leave you. Right, this is what we consider to be a threat to our equilibrium, let's say. Being hit by a car, et cetera, et cetera. These are the threats that are in modern society. Right, there's no more enemy tribes, and there's no bears attacking us. So we have a system that's sort of set up for a much more traditional lifestyle, but yet it looks like it's being activated in very unusual situations. Right, and that's why a lot of people, and including a lot of the research I do, is actually looking at negative effects, for example, of having too much activation of your neuroendocrine system associated with stress, and how that impacts, for example, children's development, et cetera, et cetera. So one thing we should think about is stress, for example, inherently negative? And of course the answer is no, because it's a normal physiological system. Not yet, I should say. We also have a lot of things that one might conceive as positive that are also stressful, right? Like, for example, getting married. Sometimes getting a promotion can be conceived as a stressful event, because obviously there's lots of changes and lots of new demands and lots of new things to overcome. Interestingly, in the research world, most people don't focus so much on these positive stressors because they don't typically relate to negative outcomes, but more and more people are looking at the effects of negative stress. Right, so these events that tend to be negatively valenced, different circumstances. And what we know is that these types of negative events that people experience lead to all kinds of negative outcomes, like major depressive disorder, for example, or cardiovascular disease, obesity, high blood pressure, just to name a few. We know, for example, chronic stress is associated with an overall higher rates of all kinds of illness, just of general health, and also a shortened lifespan. So I think we can generally agree that although stress is normative, high levels of it can be quite negative, or at least have negative consequences. But the key thing to keep in mind when we think about stress is perception is everything, right? So it's not necessarily so much what kind of stressors we face, it's how we perceive them, right? And we'll call that subjective stress. So, which is our view of what conditions or situations we see as being, difficult to deal with. And that seems to be the key thing. So one of the interesting points, and I'll get back to this in a few minutes, is our response to different events is really determined by our perception of those events. Right? So let's say you lose a job, you could tell yourself, this is a disaster, this is catastrophic, I'm going to never get a new job, I might starve to death because I won't be able to feed my family. You might become hopeless, right? And this is a perception of a stressor. One might also respond to the stressor of losing a job as seeing this as a great opportunity to get out of something you didn't like and start something new. right? So this is one of the key issues that we're going to be talking about in a few minutes, is that part of what stress is defined by our perceptions of things that we're trying to cope with, right? So if we get back to thinking about when is stress, for example, negative, one definition would be that stress occurs when we're dealing with an event or a situation that we perceive as beyond our ability to cope with, right? So losing your job is not a bad thing if you feel you have tons of options, but losing your job if you feel have no options, that is stressful, and it also activates a lot of the biology that I was talking about previously. So perception is everything, right? And you can think of this in this way: is the change that you're experiencing, is it catastrophic or is it an opportunity? And that will define, for example, whether something is stressful or not. The other thing we talk about a lot in stress is types of stress, and this is where I'll talk a little bit about the holidays as well. We try to categorize stress in many different ways. Probably the most basic way of thinking about stress is whether it is chronic or whether it is acute, right? Now, chronic stress includes the day-to-day problems that cause us difficulties over time, a bad relationship, a bad job, a chronic illness. All of these are long-term conditions that tend to wear people down. They're often these are chronic stresses associated with medical problems and also with major depressive disorder. So these are things that tend to be constant over time. Acute stress refers to different events that people face, and we'll call these either life events, or sometimes people call them negative life events. And when we talk about life events, we're talking about a single event that kind of shocks the system, right? So something happens to you and your functioning is completely disrupted. It could be, obviously, I think in the news today, there was an earthquake on the other side of the world. This would be a life event for thousands of people. Excuse me one sec. Suddenly losing your job can be conceived as a life event, right? Suddenly going bankrupt, or getting divorced, or breaking up, or being in an accident. Obviously, violence, being assaulted, victimized. These would all be examples of life events. Again, when we think about life events, we're thinking about something that might lead to, for example, different anxiety disorders. Can lead to post-traumatic stress disorder, and also major depression and other psychiatric conditions. In terms of life events, everybody experiences life events. So I think one of the things we like to think about is how severe and how many. Right. So obviously, people exposed to more life events over a period of time, and more severe life events over a small period of time, tend to do worse than people having lesser events of lesser severity. Of course, again, I'll say the same thing. I'll repeat myself one more time. Perception is everything, and we'll get back to that in a few seconds. We also think about stress in terms of the sources of stress, right? And again, I ask you now to think about what types of things in your life cause you stress, right? Think about that for a second. There are many domains, right? Like a lot of people talk about work stress, right? It's the idea that we have too many responsibilities, not enough control over our working conditions. Unpleasant working conditions, maybe if you're working in a place that's overcrowded, that lacks light, where you're feeling isolated, et cetera, et cetera. The other big one is financial stress. Financial stress, paying the bills. Are you short money at the end of the month? Are you having trouble paying a mortgage, et cetera, et cetera? These are all examples of financial stressors. Obviously, health-related stressors would be something that many people are sensitive to. Coping with a chronic medical disorder or a mental disorder, this is a source of chronic stress, right? We can certainly think of major depressive disorder and bipolar disorder and schizophrenia as being types of conditions that lead to lots of stress. Interpersonal stress is extremely important to think about. This is how we deal with people, family, coworkers, intimate relations, and friends. Do not underestimate how these difficulties can actually impede your coping and your functioning. Things like gossiping and violence in relationships, these are profoundly stressful events for human beings. Remember, we're primarily a social being, right? And we need one another to survive, at least to some extent. So interpersonal stress turns out to be the best predictor of depression, both in adolescence and adulthood. So again, interpersonal difficulties in one's life, something to think about. Now, what's different about holiday stress, or what is it that people ask me to speak about holiday stress? Well, I would say there's nothing inherently problematic about holiday stress. There's nothing particularly novel about it, different than anything I've already said. However, I do think the holidays increase certain burdens on people that they do not experience at other times during the year. So if we go through a couple of things and just think about this for a sec, certainly holiday stress, especially these days, increases financial stress on a lot of people. There's obviously this pressure to purchase and buy and spend lots of money. So this certainly is a source of increased financial stress. Certainly all the different responsibilities that, for example, people who are part of a family have in terms of tending our relationships, buying gifts, hosting people. These are all the types of stressors that we have to cope with in addition to all the other things we're doing, right? So, for example, if you're working until December 23rd and yet you have relatives coming in on the 19th, I mean, suddenly now you're coping with multiple things, right? Not just your day-to-day lifestyle, but also the difficulties inherent in having people stay over at your house and preparing extra meals, et cetera, et cetera. So this is probably one other way of thinking about holiday stress is suddenly we're managing a whole bunch of more different things than we were managing, for example, a month ago. I think a key issue that happens during the holidays is increased interpersonal stress. So suddenly families are getting together. That's great and that's wonderful, but it also it also stimulates certain problems. It also causes certain people, for example, to revisit many of the problems that they're having in their families, right? So holidays can certainly be a source of severe interpersonal stress. And as I said, interpersonal stress is a big risk factor for depression. Another thing that happens during the holidays is I think people experience loneliness. And I don't want to call loneliness a stressor, but if you think about loneliness or isolation as being something that might impede your ability to cope with your day-to-day life, so it might make it harder for you to deal with the people around you for working, because this is the sort of thing that can actually be an impediment to these things. Social support actually gives you strength to cope, with your day-to-day stressors. So I think there's a certain amount of loneliness when people engage in sort of this social comparison. The idea that everybody else is so happy during the holidays, and how come I'm not so happy? That is certainly something that can wear people down, and I think make it harder for people to manage with all the other things they have to manage during this period of time. So I think that's a significant factor, and I think that's probably something we should need to think about. So let me shift gears a bit and talk very briefly about some methods that people use in terms of how they manage stress. Of course, this is something that I can't teach people in 2 minutes, but we can certainly talk about some of the general principles. I will leave the name of a book with Blanche, who I guess you'll put it on the website, which is I find extremely helpful. It's actually called the Stress Less Workbook by a professor called Jonathan Abramovich, I think this is a fantastic book. I use it all the time in my run psychotherapy and that kind of thing. So I'm going to talk a little bit about some of the stress management techniques that are reviewed in that book, and they're certainly common to many different types of stress management programs that you might know of. So I think we can start off with 6 basic ways of managing stress. I'll try to unpack a couple of them, certainly not all of them. The first thing is problem solving, right? Maybe you've heard that term. One way of coping with stress is to deal with issues at the source, right? So, for example, if you identify a job as being a source of great stress, then maybe one way of approaching this is to consider what your options are and perhaps take that as a kind of problem and try to rectify it, again, over a period of time. And I'll talk about a few techniques in which ways you can do that. But the idea with problem solving is you learn how to identify problems, you generate solutions, you make decisions, and you implement plans to cope with a source of a stress or a stressful situation. Okay? That's the first. The second technique that's often used in stress management programs is communication assertiveness skills. And again, this really comes back to this issue of interpersonal stress and how serious it is. And this would be the type of skill where you learn to express your needs more effectively. You learn to be more assertive with the people around you. You learn to better negotiate. All these things, all these communication skills, again, the goal is that you gain confidence in yourself and you gain more respect from others and you improve some of your interpersonal relations. So communication, assertiveness skills are usually a big part of stress management. A third skill that's often used, and again, I'll tell you, this is not rocket science, but it's time management. And it's really learning skills to boost your personal efficacy and productivity. Having an agenda, planning things, putting things down in an agenda, following your agenda, that kind of thing. Identifying tasks that you have to do, breaking them down into steps. These are very basic skills. We use this and also with people who suffer from attention deficit and hyperactivity disorder, but it's clearly a very useful stress management technique. Number 4 would be, I'll use the jargon term, cognitive restructuring, but this is really learning how to respond to stressful thinking, right? Learning how to cope with stressful thinking patterns. So what does this mean? Learning to identify and correct exaggerated, distorted, or maladaptive thinking patterns that lead to stressful responses, right? So I'm going to talk a little bit about, talking back to your anxious or stressful thoughts. The 5th technique is, again, this is basically muscle relaxation and meditation. And as you know, there's tons and tons of opportunities to learn about relaxation or meditation or something called mindfulness, which is a form of meditation often used by psychologists to deal exactly with stress. Excuse me. So again, the idea here is to learn how to cope with stressful situations in some ways by accepting them and trying to learn ways of reducing some of the physical stress responses that you tend to feel. So learning to relax in the midst of a stressful situation, learning to calm yourself by freeing your mind from stress and worrying thoughts. So this is really the whole issue of muscle relaxation and meditation. And then the 6th thing is actually, again, very general and used in all kinds of things, but it's really maintaining a healthy lifestyle. And that really means maximizing good health habits such as healthy eating, getting exercise, sleeping well, and that kind of thing. You might think that's, how is that going to help my stress? Well, in fact, your ability, for example, to sleep 8 hours a day will give you, the cognitive efficiency to better cope with your day-to-day stressors, and that's been shown scientifically. So these are 6 different things that I've mentioned. One thing you might want to think about is, well, what type of stress management tool should I use in a different situation? And this is a difficult question. Let's keep in mind that there are different skills that may help in different situations. Of course, if someone was dealing with a cancer diagnosis, this may not warrant a problem-solving approach. But, a bad work situation might. Communication skills might warrant or might be useful for marital problems, but they're not necessarily going to help you cope with your financial stress. So I think it is important to think about matching the appropriate technique with the appropriate the type of stress that you're most suffering from or experiencing. You need to think about, for example, if the stressor is something that's out of your control or if it's something that's under your control. If it's under your control, then perhaps a problem-solving approach might be the best. But if it's out of your control, i.e., let's say like a cancer diagnosis, that might not be really the type of technique we'd want to use. Maybe you might focus more on thinking about meditation and mindfulness. So the other question you want to ask yourself, is this a situation that can be changed or is it something that can't change, right? As an example, so if, for example, you're 64 years of age, making a radical change in your career might be difficult. Right? Not to say that you can't make a small change, but these are things to think about. One starting point when you think about stressors is probably just begin thinking about what are the activating events, what are your natural responses, and what are the consequences. We often refer to this as the ABCs, right? A refers to the activating event or the stressful situation. B would be the belief or the thought about that situation. And C is the outcome or consequence of the stressful situation or the consequence of A. And this would be typically your emotional response, anxiety, fear, depression, sadness, anger. But it could also be a behavior like, drinking alcohol or running away, avoiding things, that kind of thing. Once you start to break stressful situations down like that, you start to figure out patterns, right? And it starts to give you ideas about what kind of stress management tools you might want to use. So, for example, if you have a situation where you find yourself during the holidays, for example, fighting with your intimate partner, ask yourself, what is the belief that's underlying some of these fights, or what are the thoughts that are underlying or associated with some of these fights? It might be something like, I'm not being heard or supported, right? The holidays often bring out these kind of feelings, especially when people are at home together for longer periods of time than they're used to. Now, the consequence, if you follow the ABC pattern, would be, in this case, anger or sadness, right? So if you're able to identify this pattern, then maybe your approach should be to focus on communication, right? How can I express my needs that I'm not feeling supported to my partner? And then you might take a communication skills approach, right? Let's apply the ABCs to stressful thinking, right? Okay. Let's take the situation where you might be shopping in a mall, not finding the perfect gift, right? So what's the consequence of that situation? Well, it's acute anxiety. Maybe you have feeling butterflies in your stomach. Maybe you're feeling dizzy. Maybe your breathing is increased. Maybe you're feeling sadness and disappointment. Well, one of the questions you might ask is, what is the B? So what's the belief or thought that links the A, the antecedent, with C, the consequence, right? Well, B might be something like, you might have the thought like, I'll never find the right gift, right? My children will be disappointed. I'm going to feel like a failure, or I feel like a failure, right? So you can clear, in this situation, clearly the B, your thoughts are driving the stress, because a shopping center is not a threatening event, but your response to that shopping center, or not finding the right gifts at that moment, are causing that stressful response. So this might be one of these situations where you need to practice changing your stressful thinking. So what do? You talk back to your stressful thoughts. You might tell yourself that my family will be happy receiving gifts, whatever the gifts are. Nobody can buy the right gifts all the time. All I can do is the best I can, right? And that's one of the methods you use to counter stress-related thinking. Now, one of the things you want to think about is, when you're doing these kind of exercises, is keep in mind that we tend to engage in what we'll call these cognitive distortions, these maladaptive patterns of thinking that seem to inherently cause us stress. And I'll just give you a couple of examples. All or none thinking, right? Sometimes we feel that all our relationships have to be great, or you're a failure. That's all or none thinking. One of the goals that we have to work on is thinking in shades of gray, right? So this is one of the examples of ways of thinking that get us into trouble. Anytime you notice yourself using the word must or should, right, this is often a recipe for feeling stress, because thinking in terms like musts and shoulds tends to lead us to disappointment and frustration, right? So people must do what I want them to do. It's sort of, we would like that to be that way, but certainly it's not necessarily going to happen, and we're going to typically feel frustration in those situations, right? Things should work out. Things should work out if I try hard. I mean, obviously that's something we all feel, but obviously we know that doesn't always happen that way. So that's one of the issues you might want to focus when you notice stressful situations arising. Am I engaged in this in lots of thoughts that involve musts and shoulds? The third one is also, we often jump to conclusions, right? And this is some ways where we, even though something hasn't happened, we automatically assume that something dreadful or terrible is going to result, from something that happened to us. So, for example, you made a mistake at work, and your thoughts might tell you that you're going to lose your job. Your colleagues are going to think you're stupid. I call these negative predictions. We can't read the future, right? So we have to sort of remind ourselves that we don't know what's going to happen. You made a mistake. Perhaps you might get some repercussion at work, but the chances are your negative initial reaction is unlikely to bear out. So these are ways of thinking about addressing your stressful thinking. Now, how do you do that? Again, you challenge and talk back to your stressful thinking. So you talk back, identify the musts and shoulds. You remind yourself to focus on grays and not all or nothing thinking and that sort of thing, right? And one of the things you might want to ask is, when you notice a stressful thinking pattern, ask yourself, what's the evidence for what, my interpretation of the situation is, my belief about this situation is? And you can ask yourself, well, what does my past experience tell me about this, right? So, for example, if I have a thought that, it's so terrible that lost a boyfriend or a girlfriend, it's the end of the world. Ask yourself, well, what has happened in the past? Well, in the past I felt sad, suffered a bit, and then got over and met someone else, and life went on. Right. So you might ask yourself, what have other people experiences been? When just trying to identify some of these absolutes in your thinking. How might someone else look at this situation? What would I say to a friend about this if the roles were reversed? Again, the idea here is that you can actually, in many cases, you can't change an actual situation, but you can always change how you think about a situation. And that's the key thing about engaging in some of these stress-related, we'll call it cognitive restructuring. Okay, so I think I'm more or less run out of time. I will say a couple of things about problem solving just before I go, and then we'll open the door for questions. When we're facing a problem, right, that we've identified as causing us a lot of stress, there's a very systematic way of approaching this. And I'll give you just 4 steps that you can keep in mind when you want to tackle a situation that might be causing you stress. Is ask yourself, first of all, what is the problem, and define it in very, very specific terms. Right. So if you're suffering financial problems, define exactly what those financial problems are. Is it that you're having trouble paying rent at the end of the month? Right. Is it that you're having trouble paying for groceries? I mean, identify what the issue is, when it occurs, in great detail, because that's going to help you define solutions. And then step 2 is really you want to define the problem, you want to clarify, you want to identify how often it occurs, when does it occur, where does it occur, who's involved, all this kind of thing. You really want to define the problem in great detail. And then step 2 would be to generate solutions to that problem, right? And the key thing about this is you want to engage in something called brainstorming, right? And you want to list all potential solutions, no judgment, right? Just put them all out there. Get a second job, drive a taxi, rent out a room in my house, rob a bank. You put them all out there. Whatever it is, you just list it. The key thing is you want to let your mind open up to all the possibilities, because sometimes we get very rigid and we forget possibilities because we're so rigid in thinking that I can only do X or Y, when it's possible there might be a Z out there and an A, B, and C as well. And then once you've had that, you can actually start evaluating in step 3 each one of those possibilities by looking at advantages and disadvantages of each one of them. I mean, and you can ask yourself a few questions. How feasible is this solution? How does it affect me and others close to me? How well does it fit with my values, goals, and other commitments in life? So, for example, robbing a bank might not fit very well with my own personal values, so I might take that off the list immediately. But this is how you want to think about it. How much time and effort will that particular solution require, and what are the financial costs and benefits? And using these techniques, you can sort of narrow down solutions, and then again, always focusing on pros and cons and writing them out so you can actually see them. And then the key is then once you've identified the solution that has the most pros and the least cons, and it fits with your values, and it's not overly expensive, and it's possible in your life setting, then you need to enact it. And the key thing here is to plan it, to write it out, set it up, make what we call an action plan. Actually define the actual steps that you need to take to carry out that solution. And then once you do that, once it's actually done, review the progress and see what's happened. And hey, maybe it didn't work, maybe it did work. If it didn't work, you start over again. Nothing lost here. You learned something new, even if it didn't work. But this is generally what the kind of way we approach problem solving. And this is a very powerful technique in dealing with stress. I'll be honest with you, it's probably the one we use the most, because often people can identify sources of stress that they do have some control over. So I'm going to stop there because I've talked way too long already, but I'm certainly happy to answer questions. The one thing I can add is some of these techniques I've actually been using in a program which we've applied to families, just in case anyone's interested, families in which one of the parents has bipolar disorder. And one of the things we've been doing is actually teaching parents to better, for example, organize their households, to reduce stress, to help the kids, because we've actually realized that stress in families has a negative impact on the children. So we have actually a 12-week program where we teach parents, for example, to better communicate with each other, how to problem solve both personally but also problem solve for the family. So for having kind of these family problem solving sessions. and also help these parents be much more organized and consistent, and also better able to, for example, to discipline and that kind of thing with their kids. And then what we've also been doing is teaching the kids to better cope with stress. We've been teaching the kids how to relax and engage in some of these cognitive coping strategies. But one of the things, again, we think about is actually stress in families where there's mental illness. That's a negative thing both for the person with the mental disorder, because we know that stimulates relapse and more episodes, but it also has these negative impacts on the kids. And I mean, we're just looking at the outcomes of the results, but it looks like this program we've developed is actually really having interesting effects. And these are for kids between 6 and 10 years of age. So some of the stuff I've been always talking today about is individual, but you can't think about this in the context of your family. As you said, your term caregiver kind of started making me think about that.
Hello, this is Dale. Can you hear me?
Dale?
Yes.
I can hear you.
Hello. I wanted to, yes, I'm a caregiver. My sister has a mental illness, and during the holiday season, it's especially difficult for her. And we just had someone very close to us pass away this year, our mother, so it's even more difficult.
Yeah.
I really appreciate the information you provided, because I think, in my case anyway, it's definitely the communication, assertiveness skills that I really need to apply. And also not to jump to conclusions sometimes, catastrophic thinking.
Yep. Yeah, these are all important. And I think, obviously one of the things that happens in the holidays is you're surrounded by all these cues that trigger memories, right, of your loved one. So this is difficult for everyone. So I can see this being, rather difficult. And of course, if someone is struggling with a mental disorder, I think in some ways it's even doubly difficult for them in many ways, right?
Yeah, she's really struggling now and self-medicating, and has distanced herself from me. So it's really tough. I just need to find a way to not become so stressed and worry about her. So I just need to relax, because I can't continue. Worrying is fruitless. I have to know that she's doing her best and she's taking care of herself.
Yeah. No, you're absolutely right. Obviously the principle here is if you can't take care of yourself, you can't be much help to your sister. So,
exactly.
So
exactly.
The key thing here is exactly you need to focus a little bit about on coping with all the stress you're dealing with, and then you'll be in a better position to help your sister.
Exactly. And then just to, there's nothing I can do right now, so I just, if she calls, just to be there to listen. And
exactly. And I'm assuming the holidays will at least force her in some ways to come spend time with the rest of the family, right?
We're kind of limited. It's really just the two of us. So it's kind of a tough situation.
Yeah.
The rest of our family is not here.
Right.
So, but it's always been a very, very difficult time of year because of what you mentioned. A lot of these cues, and it brings back memories. So, so I guess, I really appreciate all the information you provided, because it puts in place exactly what can be done to help. So thank you.
Absolutely. Yeah. Like I said, I'll give you this reference to this book. It's a really great book.
Yes. Yes, I'll check it out.
Yeah. You can probably get it anywhere, including Amazon.ca, pretty easily.
Okay. Thank you very much.
Thank you for your great comments, and I think take care of yourself.
Yeah, exactly.
And that I think will lead to better things in the relationship. Personally, I think that's the way I would go about it.
Okay, thank you.
I should add too that everything I've talked about is really something that you probably could deal with any licensed psychologist in Quebec, if you ever have an opportunity. These are all things, the skills that psychologists should know about and should be able to actually work with you.
In fact, I have seen a psychologist who did speak about it, and I think I have a book relating to A, B, and C, the activating event and the belief and the consequence, which really is helpful.
Yep.
So, yes, it's very helpful.
Yeah, the ABC idea is really, that's just sort of the core of what we call cognitive behavioral therapy. So it would be on any kind of resource for cognitive behavioral therapy. For people who are interested in that type of thing, there's a book called Mind Over Mood, which I think is fantastic.
Okay.
Mind Over Mood is a book written by Christine Tedeschi and someone else. I can't remember the name right now, but it's really a fundamental, easy book to follow that teaches you how to respond to maladaptive thoughts. The rest of the book actually is called Mind Over Mood. I think it's called changing how you feel by changing how you think, or something like that.
Okay. Oh, very good.
And it's really the core of what is called cognitive behavioral therapy, and it's used as a treatment for depression, but you could apply it to anything. You can apply it to anxiety problems. You can apply it to problems with aggression. You can apply it to dealing with stress. So that's the second book I would highly recommend. Yeah, that one's easy to find because it's a big seller called Mind Over Mood.
Okay, thank you.
My question is the name of the first book that was recommended.
The name of the first book is called The Stress Less Workbook.
The Stress Less Workbook.
Yeah.
Okay.
Catchy. Stress Less Workbook.
Yes.
and it's called The Simple Strategy to Relieve Pressure, Manage Commitments, and Minimize Conflicts. But the name you need to think about is Jonathan Abramovich. That's ABR.
Abramovich?
Yeah.
Okay. Yeah, now I know how to spell that.
There you go.
Abramovich. Is it VITCH or VICH?
It's WITZ.
Oh, WITZ. Okay.
Yeah.
Good thing you told me.
Yeah.
WITZ. Jonathan Abramowitz. Okay.
He's a psychologist, and he wrote. He spent a lot of time running workshops and teaching people how to cope with stress. It's a really excellent book.
Okay, and I can personally recommend the Mind Over Mood workbook. That is excellent as well.
Exactly. Yes, I use it. I use it all the time. I use it in therapy.
Okay.
I love the book, Mind Over Mood.
And I'm curious where you are running this program that you mentioned. You have, you said you have a family in treatment, and yep. I'm wondering where is this happening?
Well, this was in Concordia University.
Okay.
We're running it between. We stopped now. We were running it between 2013 and about 2015.
Okay.
We had funding to run a relatively small study. We did it with. We had 30 families approximately, and
right.
30 control families. So this was an experimental study because we created this program. Now we're seeing if it works, and right now we're analyzing the data to see if, in fact, if it is working. And what we'd like to do in the future, and we're trying to get money to do this because again, these things cost money. We weren't certainly the people weren't paying for it, but we would like to do this in families who have a parent with depression.
Okay. And how do you recruit people for these studies? How do people find out about them?
We were recruiting in newspapers, on the metro, mostly around Montreal, though. I don't know if you're calling from Montreal.
Yes.
Okay. So yeah, we were recruiting through different internet venues. Kijiji, anywhere and everywhere. We were recruiting for AMI-Quebec as well.
Okay, and for example, is there a website for your center that perhaps you
absolutely
you have things going? Okay, and can you give us the information for that?
Yeah, just use my name, which is Mark Ellenbogen.
Okay.
ELLENBOGN at Concordia.
Okay.
Just put Mark Ellenbogen Concordia, and you should get to my website, which is needs to be completely updated, but there should be a link to this program.
Okay.
But we're not actively recruiting right now. Right now,
I understand, but just to sort of maybe check in from time to time and see what's happening.
And we do a lot of recruitment through Revivre, which is the French support and organization that deals with affective disorders in Quebec.
Right.
So we got most of our families came through them.
I see.
We ran
French
and English groups. We had trouble recruiting English families actually. Yeah, we couldn't find enough. So,
really?
Yeah.
Wow.
It's a small community. I mean, we were looking for families who had children specifically between 5 and 10. So.
Okay.
So it was a small. We're focusing on that period before adolescence because we think, for us, we think the interventions have to occur before the kids reach adolescence. We think a lot of things go on before that we want to stop from happening. In terms of changes in their biology and changes in problematic behavior and behavioral patterns that begin around that age. So.
Okay. Excellent. Okay, good. Well, thank you for all this information. I appreciate it.
My pleasure.
If I'm looking at the clients that I see and the type of stresses that they're sharing with me, some of the stressors are related to hospitalizations of their loved one, taking out court orders, and how that affects the relationship, the repercussions of, especially during this time of year, and there are some people going through that process right now, and not knowing how to cope with the stressor of having a loved one in hospital while this season is coming about.
And you're speaking to me from the perspective of the family members of the person who's hospitalized. Is that what
it's stressful for both, actually. Yeah. You know, for the person being in hospital over the holidays, or for the family having a loved one in hospital over the holidays.
Yeah. Yeah. No, listen, there's no way around describing that as a very difficult situation, obviously, for both the patient and the family. Again, I think it's something that I think the best thing in those situations is actually to just pay as much time you can visiting in the hospital during this period, because obviously this is a type of period where people are extremely susceptible to feelings of loneliness, and I think certainly being in a hospital setting, I can't see how I could see it being difficult to avoid feeling lonely, feeling like you're cut off, even though they might certainly understand that it's necessary, and it's obviously if someone's hospitalized there's a reason for why they're there, but I still think it's difficult to get away from the feelings that you feel cut off from everyone. So I think my advice would be it's not an easy situation to cope with. I mean, I think the important thing is you look to other family members for support. You make decisions as a group, including the patient, right, and his or her doctor or medical team, etc. And that you just try to normalize things as best you can. So, it might mean just simply increasing the rate at which you visit during the holiday period. Make that part of the routine, part of your holiday routine, that people go to the hospital to visit, as difficult as that might be. But that's the only thing I could think of.
Sometimes it's a situation where the loved one does not want the family visiting, but the family wants to visit.
Yep.
And what I tend to suggest is that they can show up, bring a book, be in the public space so that their loved one knows they're around. If they want to come out of their room to see their family member, they can. If not, they don't. And I also encourage caregivers to limit the amount of time that they're spending, the duration of the visit, according to what anxiety they're experiencing at that moment in time, so that they are not also putting out on their loved one their own anxiety. The anxiety kind of flows back and forth between people, and if one person's anxious, the other person will pick it up, and that's very difficult to hide. Do you have any ideas on that?
Well, you're getting to situations that are quite obviously very complex, right? I mean, the first question you would ask in such a situation is why is there so much? Why are there so many difficulties in terms of family members interacting with each other? So this is a whole other problem that would suggest, for example, the need of also family therapy and that kind of thing, because this is of no help to a patient to be isolated from family members and friends, etc. It's not going to be helpful in the longer run in terms of in terms of relapse and their functioning, etc., etc. I mean, everybody needs a certain amount of social support. Everybody needs interactions with other people.
Yeah.
So I like all the things you're saying about setting up the situation where if the person wants to interact, they can. But I agree with you. I think we know, for example, family stress, hostile interactions between family members triggers schizophrenic episodes. It can also trigger episodes of bipolar disorder. So by all means, you in this situation, you'd want to ask explicitly the family members to not basically express, or this is not the appropriate occasion for them to share their anxieties and their worries. This is more the occasion to share stories and what people are doing, and sort of talk about things other than, for example, medical conditions and all that negative stuff, I think.
That's a great point. Yeah.
You have to keep that in mind. I mean, that's one of the reasons people are hospitalized is because there's too much stress in their homes. We know that. That's one of the things that a physician that's why they'll make that decision in many cases. So it really does signal that perhaps this is a situation where maybe family therapy is warranted. Certainly, one of the best treatments of that I know of for bipolar disorder is called family-focused therapy. It's by a guy called David Milkovich. He actually wrote a book on it, and he's also written a book called The Bipolar Disorder Survival Guide, which is fantastic, and it talks about all these things about reducing stress in families to help your loved one with bipolar disorder, in terms of getting better, reducing relapses, reducing episodes. And it's all about exactly how to appropriately communicate with your loved one who has a serious mental disorder. How to communicate in a way where you don't judge people. It's extremely important. I mean, that's one of the things that patients report all the time is they feel they're being judged by their family members. It's their fault. That it's something they're not trying hard enough. They're in the hospital because they're not, not taking their medications, or they're not doing what they're supposed to do. And it's much more complicated than that.
It has many layers to it, it can be. I would say that one of the most important things is to establish some sense of presence and letting your loved one know that you are available, whether it's one-way text or even if your loved one, I'm praying that many loved ones will not be in hospital this holiday season and would be enjoying their experiences with their family. That's what I'm hoping to see or to hear from the clients that come into AMI-Quebec, is to have positive experiences with family.
Yep.
Hi, can I ask one quick question? My name is David.
Hi, David.
Hi. So, Dr. Mark, thank you so much for your presentation, and thank you, Blanche, for hosting this.
Thank you.
Welcome. I wanted to just pick up on that last point.
Sorry?
Could you repeat the name of the book or the approach?
It's called The Bipolar Disorder Survival Guide.
Okay.
By David. It's actually spelled Miklovich. I think his name is actually called Milkovich, but it's Miklowitz. And David, I know him. He's actually a colleague of mine. He's currently at at Stanford, I believe.
Okay, great.
But it's an excellent book. I have to say, it's we've done a lot of work with families with bipolar disorder, as you've probably noticed.
Yeah.
We did a longitudinal study of kids. We tracked them from their childhood between 4 and 12 years of age until they've actually grown up. And I would actually go out and buy this book for a lot of those kids when they reached adulthood, just because it's so full of good information about the medications, about how to cope with bipolar disorder, good information for parents, for siblings, about how to promote a positive, healthy family environment that actually promotes wellness in the patient and reduces relapses. And everybody wins, So it's a very focused, skill-based kind of book with all kinds of really, really great advice and very stimulating too. It's a book that presents lots of ideas. It's wonderful.
Do we have time for another question?
Mm-hmm. Oh, yeah.
What do you think it takes for somebody to actually learn these skills and actually apply them day to day? Because I feel like a lot of the time it's easy to know what these skills are, but it's a whole other thing to actually live by them. Obviously, nobody's going to be perfect, but what is it that it takes exactly to integrate them into?
Yeah, no, it's a really good question, and actually, I think you've hit the nail on the head in many cases, because one of the problems with a lot of these types of skill-based approaches is people forget that the first thing you need to address is motivation. And so, for example, as a someone who does psychotherapy, I mean, so the first thing one would address even before doing any of these skills is talking about motivation and getting people to sort of, identify what their personal motivation is, right? To use these skills and sort of get them to sort of reflect on, their life at present and how they would like to see their life, post, like after learning some of these skills, and get people to really, in some ways believe or at least accept that they can actually learn these skills and actually make those changes, and then also identify what are the obstacles that might block them from using the skills, and that's another critical part. So part of what you think about is what might stop you from using these skills, and then you have to address that. Like, you have to think about what the obstacles are. But I think the key thing is once you have the motivation, identified, and people feel motivated that they really want to try something new, they want to make a change, because change is hard and not everybody's ready for change at the same time, right? That's the other fallacy. We assume that everybody can change at any moment. Well, no. People experience things and they might have to hit a certain point in their life before they're ready to make changes. So once you have the motivation, you're at that stage where you want to make those changes. I think the other key issue is really just practice, and in many ways, like if you're learning tennis or squash or whatever. I mean, you have to practice over and over again before you start feeling like, wow, this is actually not as hard as I thought it was. Because in the beginning, it's always hard. So you almost have to remind yourself, I got to practice. And then, with a lot of practice, a lot of these skills, at least the way it's supposed to be, is this is supposed to become automatic. So initially, like this cognitive stuff is all like it's effortful. You're making an effort. You're asking yourself, so what went through my mind just before I felt, anxious or sad, and you're doing this. But the idea is if you do it over and over again, it becomes like an automatic thing that you just do naturally without even thinking about. And that's the ultimate goal. That's where you want to get. But that takes practice. So.
Okay. Great. Thank you.
Yeah, that's a great question. Thank you.
Mark, it's been informative, a pleasure. I'm going to repeat again AMI-Quebec's internet address. It is www.amiquebec.org. And to register for upcoming teleworkshops or for any other information or assistance, you can call us directly at 514-486-1448. I'd like to emphasize that for those of you who are caregivers and do not have easy access to counseling in English, we offer it to you by phone or Skype. This is for those of you who are living outside of the Montreal area. Just dial 1-877-303-0264 to put your request in, and someone, probably me, will call you back and do and explore what your needs are at that moment in time. So thank you all again for being here for Coping with Holiday Stress teleworkshop. Sincere thanks, Dr. Mark Ellenbogen. Good night, everyone.
Good night.
Good night.
Happy holidays.
Happy holidays.
Happy holidays.
Bye.
Bye-bye.
Bye. Take care.